Hello, everyone, and welcome. Thank you for joining us today for our UN Behavioral Science Group webinar on using behavioral and experimental evidence to inform global development. For those of you who haven't joined our UN Behavioral Science webinars before, my name is Mary McLennan. I am moderating today's discussion, and I am the Senior Advisor on Behavioral Science to the Executive Office of the Secretary General. And I also lead an initiative called the UN Behavioral Science Group, which I'll come to shortly. So today's session will be joined by colleagues from two organizations, which I'm sure and many of you have heard about for their work. So the first is JPAL and the second is UNICEF, and we'll discuss this topic with them. But before we go into the specifics of today's discussion, what I wanted to do is back up a little bit and just speak to the UN Behavioral Science Group. I know we have a few people joining who are not necessarily engaged with our efforts. So the UN Behavioral Science Group brings together over 3,000 UN colleagues from more than 70 entities and 130 countries. So it's a lot of interest and demand for behavioral science across the UN. These are the UN colleagues. You can also join as an observer outside the UN. You get invited to webinars that we host, newsletters that we send out about quarterly. And one particular event you might want to know about is Behavioral Science Week, which is taking place in about a month from now. So there's lots more to engage with when it comes to the UN, both in and outside. And I'll share in the chat the link to join for UN Behavioral Science Group resources, as well as to join the UN Behavioral Science Group. Okay, so now in some context here, if you haven't heard, behavioral science is part of what we're calling what is called UN 2.0, this quintet of change. So these are come from the priorities of the Secretary General, and it's about a forward-thinking culture and really changing how the UN works and adapts to basically what it's like to be working in the 21st century. So these 5 areas that the Secretary General has deemed important for the UN to be nimble and effective and really deliver on his ambitious agenda are data, digital transformation, innovation, strategic foresight, and behavioral science. So you'll see in the links that I shared there, there's also a bit more to read about behavioral science within the context of this quintet of change and the strong support that we have from senior leadership. Just to say, the Secretary General come out, make numerous statements about the importance of behavioral science. This just one here calls it a critical tool for the UN to progress on its mandate, and also strongly encourages colleagues to work together, which is what we do in the UN Behavioral Science Group. Okay, so enough about that. What I will say, if you can join the group, as I said, there are also a number of documents on that link that I shared if you're curious to know more about what's happening across the UN in this area. So the first is the Secretary General's guidance note, if you want to know more specifically what the Secretary General thinks and his vision essentially for behavioral science in the UN. There's the UN Behavioral Science Report, which covers the experiences of 25 entities. There's also the UN Practitioner's Guide to Getting Started, which really takes a lot of the thinking from behavioral science and packages it in a way that's relevant to the UN. And then finally, there's a UN 2.0 policy brief, which again unpacks more about those 5 areas that I just mentioned. And to say as well, we'll be having a UN 2.0 week too next week as well. We can share those links in the chat as well. Okay, and you can also join the group at that link. As I said, you can be a part of our discussions both in and outside the UN. Okay, so with that, on to our session for today. So as I said, I'm moderating the session, and you have the opportunity to use the chat to speak to others on the call today, to discuss whatever you'd like from our panelists or our presenters. But if you would like to ask a question, please put it in the Q&A box. I will only be taking questions from the Q&A box. And even if you don't have a question yourself, check out the box because you have the opportunity to upvote questions of your colleagues. Okay, so before I turn it over to our panel today, I just thought I'd take a bit of a moment here to really kind of get us all at least on a similar page when it comes to what we're speaking about when we think about behavioral science. This is the UN Behavioral Science Group webinar. So the way we've defined behavioral science in the UN is quite a broad umbrella definition. So we talk about it as an evidence-based understanding of how people actually behave, make decisions, respond to policies, programs, and incentives. So we often think about assumptions that we make in policy and programming, and how can we really dive into them to have a deeper understanding of what it's like in the real world is essentially our overarching aim when we think about behavioral science. So breaking this down a bit further, we speak about 2 areas that really kind of define behavioral science. The first is that we draw from behavioral science principles, the literature from psychology, sociology, anthropology, economics, and we think, what do we know about, say, social norms or defaults that be relevant to this context that we're perhaps studying? And the second area of work that we really focus on when we think about behavioral science is this testing component where possible. So it's important to really understand what works, and we'll dive into a lot of that in today's discussion, particularly for when we're thinking about human behavior, because it's obviously very nuanced in different contexts. So what works in Buenos Aires may not work in Cape Town, and how do we really leverage this behavioral science thinking in a way that's meaningful in different contexts in which we work around the world. So hopefully that helps to set kind of a bit of a link between this evidence-based thinking we'll go a bit harder into today, but also in the broader behavioral science discussions that we've been having over the last number of years and are continuing to have today. Okay, so with that, I'd like to introduce our panel. So we're joined by colleague first Ying Gao from JPAL MIT, where she's a senior policy manager. And we're very fortunate to have her with us to share her insights after doing many years of work both within JPAL. And we also have Nadine El Ashwami, who's from JPAL American University in Cairo, where she's a policy manager as well in the Middle East and North Africa region. We're also will be hearing from Lina Nabarawi from UNICEF Egypt, where she's a social policy specialist, and she'll be speaking about her experience working with JPAL on projects within Egypt. And then finally, we'll hear from our colleague Kash Ramli, who's from UNICEF Social and Behavior Change, where he leads behavioral science efforts. So with that, I'm going to stop sharing and turn it over to Ying for a presentation.
Wonderful. Thank you, Mary, for that excellent overview and very kind introduction. We are very happy to be here and joining the discussion. So very briefly, I'm going to cover a little bit about what we mean by behavioral and experimental evidence. How does it work? Giving you a couple of very concrete examples and the variety of problems that it can be applied to, and then wrapping up with just my thoughts on what are the few things that we see in opportunities of greater collaboration with stakeholders within the UN system, all with the aim of making concrete progress towards sort of using evidence to inform the global development activities, right? So JPAL was founded as a policy and research organization 20 years ago with a very similar motivation as what Mary has shared for this group. Essentially, we understand that poverty is complex and extremely complex, driven by many interrelated factors. And that is because we as humans are also complicated creatures, and society is complex as well. But we believe that we can fight poverty with a very powerful tool, which is scientifically informed understanding of human behavior, and specifically how people in the real world respond to policies and programs that are intended to improve our lives, right? And I want to start by sort of saying that there are many different problems that JPAL and its partners have tackled over the years in terms of, problems that are critical to global development. But one recent example may be rice stubble burning in India. So what is rice stubble burning? Great number of farmers in India are engaged in rice and wheat cultivation. That requires, when the rice season is over, for farmers to clear the field to get it ready for wheat cultivation. Now, one of the cheapest ways of clearing the field from the farmer's perspective is to burn the stubbles, rice stubble burning. But in the aggregate, this has enormous negative consequences, right? It is obviously not a very sustainable sort of agricultural production process. It creates pollution, it creates health hazards. It was responsible for estimated 66,000 premature deaths in India. It is single-handedly responsible for 30 to 40% of Delhi's winter pollution. And despite the government prioritizing tackling this problem for a long time, it has increased. So emissions from crop burning has increased 75% since 2011. So that means effectively attacking this problem will help us make progress towards a number of different important goals, from mitigating climate change effects to improving the health and well-being of city dwellers. And obviously, people experiencing poverty are the least protected from pollution. So we agree on the problem, and we actually have no shortage of ideas for solution against stubble burning. So some of the ones that are considered are, we could educate farmers about the harms that this causes. We could impose high fines and enforce it extremely strictly. We could come up with technological innovation, equipment that would help remove stubble and subsidize sort of adoption of technology. We could directly incentivize farmers not to burn by giving them cash incentives. However, each solution actually also come with many, detailed additional layers of question, right? If we're informing farmers, that we assume that they don't know what is good, but however, that doesn't take away the costs and benefits misalignment here. High fine and strict enforcement, who is going to enforce it? What about corruption and leakages? Equipment, how do we incentivize new technology adoption? And then cash incentive, right? How do we design it? How do we deliver it? At what time, targeting whom, etc. So we're faced with many, many design and options when we try to deploy policies and programs to tackle critical problems in global development. And how do we make decisions faced with all these different choices? Do we sort of fall back on our own individual instincts? Do we end up with a kind of inertia? Or are we looking for that new silver bullet that's going to solve it all? Or do we apply a clear framework that would be informed by high quality data and insights from the field? So this is where we believe that impact evaluations can be highly informative in not only informing the unique program's effectiveness, but also in drawing out insights that can inform all the future programs and similar programs and broader policy framework. So what I'm going to talk about next is very short summary of what is randomized evaluation, which is one type of impact evaluation that is particularly powerful. And that has been sort of the core of movement that is JPAL as well. So in randomized evaluations, we start out in this way. So we identify the participants that are relevant to the program that you are considering. So in this case, farmers in certain regions in India. And then we split the target participants into two groups at random, right? There's one, we employ a lottery process, or it can be anything. It assigns randomly persons, in this case, farmers, into a group that would receive the program, treatment group, and the group of people who are similar in every way to the treatment group, but who do not receive the treatment. And then we collect high quality data and observe the different outcomes in terms of the outcomes that we care. For example, in this case, burning or not burning the crops. And random assignments ensure that despite the world being as messy as it is, your program's independent contribution to the different outcome, you can look at it with high confidence and say, okay, it has worked by how much? And then along the process, it tends to yield a lot of additional insights and data points for you to take into account as you reflect on the outcome of the program. So taking a broader view, this has been applied to many, many different problems and different sectors, from education to sort of crime and violence. And it has been a real movement that has transformed how we do development economics over the past 20 years. And at the core, again, is really motivated by a desire to understand human behavior, all in the service of improving policies and practice in development. And some of it you could read more in, for example, a book that's being authored by our co-founders, Poor Economics, etc. And throughout this work, local grounding has been central in generating evidence and informing policies. And we've grown to be based in 7 regions and over 2,000 evaluations, so that you could think of the stubble burning as being a one dot in this many, over 2,000 evaluation and partnerships. Now let's circle back to our initial example, right? Stubble burning, what has happened? JPAL researchers have partnered with the government of Punjab to implement a randomized evaluation of a novel design of sort of payment for ecosystem services to tackle the stubble burning problem, right? And then it has found that specifically payment for ecosystem services in this context was highly effective, and designing it to deliver partial upfront payment was particularly effective in helping improve the take-up of the program. So that was the outcome. There's a bit more on the design of the research that I would not go into the detail, but just going to skip over, but it was divided into sort of 2 treatment groups and 1 control group involving over thousands of farmers and hundreds of villages. And then that has also yielded basically information along the theory of change behind the payment for ecosystem service, that is looking at not just input, but in terms of how that translates into output, outcome, and then ultimately goal. So within looking at our work across the JPAL network, we have similarly partnered with sort of UN entities in different evaluations. This has been done in a very decentralized way, researchers each partnering with on-the-ground partners. And just to share a little bit, this has encompassed diverse programs from sort of peace-building programs to sort of refugee livelihoods and education programs. So there's already a history of collaboration between sort of researchers applying randomized evaluation in different UN programs. However, to wrap it up a little bit, we do think there's greater opportunity in terms of deeper collaboration and more insightful input into that we can provide into to different stakeholders within the UN system. And that is because JPAL works across sort of 3 pillars of activities. And what are they, right? So we think that behavioral and experimental evidence, as embodied by sort of the growing body of knowledge and community of researchers, of which JPAL is a part, can inform UN in 3 distinct ways. One is research co-generation, right? Randomized evaluations tend to yield high quality data, and in the research process itself, gives a lot of timely information to innovative programs as they are being rolled out. So deeper collaboration from the start to co-generate evidence could be very fruitful. Secondly, we just have more and more growing body of evidence on all the different sectors that we can help to inform policy and practice when things are being designed or technical advice is being provided, for example, to member state governments. And then thirdly, we provide education, training, and capacity building programs. So we do have online and offline, including master's program that has enrolled, over 750,000 learners globally. It is very accessible. And that is also a very important point in terms of sort of democratizing and even increasing more local grounding of this evidence-based behavioral approach to global development. So with that, however, that was all a little bit abstract. How does this all look like in practice across these 3 different collaboration avenues? I'm going to pass it to my colleague Nadine to share a little bit about our recent experience with UNICEF colleagues in Egypt.
Thank you, Ying, and thank you for the invitation to speak today. I'm happy to talk briefly about JPAL MENA's work with UNICEF Egypt. Next slide, please. So JPAL Middle East and North Africa is JPAL's 7th and newest regional office. We launched in July of 2020 and we're based at the American University in Cairo. In 2019, so shortly before the formal office launch, we partnered with UNICEF Egypt to launch what we call a Global Evidence for Egypt Spotlight Seminar Series. And as part of this partnership, we bring Egyptian policymakers and development practitioners together with JPAL-affiliated professors to discuss priority policy issues that affect children as well as the youth in Egypt. We do this through seminars where JPAL-affiliated professors focus on the selected issues from a global research perspective, using evidence generated from randomized evaluations around the world to tackle these issues. And then policymakers and development practitioners then follow up in the panel to ground the evidence into the local Egyptian landscape and offer concrete policy solutions to the challenges discussed. So these public seminars are usually followed by closed sessions where affiliates discuss their own research with a smaller set of policy and development actors, and then explore avenues for evidence generation by engaging in discussions around how evidence can help inform the design and delivery of ongoing and future programs led by participating entities. And the aim of these closed sessions is to help facilitate research partnership development discussions. And we were actually able to launch an evaluation with UNFPA around assessing the impact of a 360-degree edutainment campaign that focuses on family planning, as follow-up to a seminar that we hosted together with UNICEF on promoting family development in order to curb the population growth rate in Egypt. Next slide, please. So since the onset of this partnership, we hosted together a total of 7 seminars, 1 roundtable discussion, and 1 conference on topics ranging from employment and education to gender, health, social protection, and climate change. These events are usually highly attended, and we have high-level representation from government sitting on the panels. So for instance, we had the Minister of Social Solidarity in Egypt sitting on the panel on 3 of our seminars. And UNICEF is also supporting a JPAL-MENA initiative called the Egypt Impact Lab, which is essentially a lab embedded inside the Ministry of Planning and Economic Development in Egypt, with the goal of helping advance a culture of evidence generation and use inside the government. We have several strategic partners in the lab from the government, and we aim to generate evidence related to 3 priority thematic areas, namely social protection and poverty alleviation, employment, and micro, small, and medium enterprises development, as well as women's empowerment and family development. So in the newest phase of our partnership, we ran a 3-day training course called Evaluating Social Programs, Targeting Egypt Impact Lab Strategic Partners. And this is essentially JPAL's flagship course on why, how, and when to randomize. And the goal of the course was to help build the capacity for evidence generation and use among government partners, as well as partners who work with the government on national projects. And so looking ahead, we will work together over the coming year on running 3 more seminars, the first of which is scheduled for May, which will focus on digital learning. And we will also work together on a training course that targets local researchers in order to help further strengthen the ecosystem for impact evaluations among researchers in Egypt. And we're also exploring evaluating the impact of 2 UNICEF programs across the gender, education, and social protection sectors. So overall, this is a partnership that has been growing over time to play an important role in advancing a culture of evidence-based policymaking in Egypt by basically cutting across the 3 main activities that JPAL runs. So essentially by disseminating evidence from what has worked to reduce poverty globally, shaping new research opportunities, and building the capacity of government partners, as well as local researchers to generate and use evidence from randomized evaluations. And we're happy to be doing this work with UNICEF in Egypt to ultimately help improve development outcomes for Egyptians. And we look forward to the continued growth of our work together. And with that, I will hand over back to Mary.
Great, thank you for that really helpful presentation to understand what JPAL is and where you came from, and a nice example from Egypt as well. So now over to a colleague from UNICEF Egypt. We can also put the links in the chat, Ying. Feel free to put, I really liked you had examples already of how you're working with the UN. If you have some links to those as well, I think colleagues might want to hear exactly how you're working with UN entities.
Great.
So now over to Lena from UNICEF Egypt. What was your experience working with JPAL? What did you achieve, and what are some of the lessons you learned from a UN perspective in particular, exploring some of these topics and areas of work? Over to you.
Thank you so much, Mary, Ying, and Nadine. And thank you specifically for Nadine for putting together in just a few minutes the work that we've been doing with JPAL over the past 5 years. I think for me personally, I've been part of this partnership since day one. So I've seen it from basically conception, from just being an idea of how can we bring global evidence for Egypt to strengthen the evidence-based policymaking, to actually expanding not just with a focus on the global evidence through the vast evaluations that are conducted by JPAL globally, but also to move forward with locally produced evidence. And let me just also take you back a bit. When we first started this partnership, I have to say there was little to no knowledge about RCTs in general across both the government, development partners, but also even the researchers. So I think that we've started this work trying to bring together the global evidence that are available, because I'm personally a true believer that even though locally produced evidence is crucial for us to be able to inform our programming or establish new programs or to go for scale-ups, however, there's a lot of learning that we have from global evidence, whether from the region or even from globally. So this is basically where the idea of the global evidence for Egypt came from. It's basically to bring the evidence from elsewhere in similar context. And we can actually say with some confidence that some of the RCTs, so some of the interventions that were implemented elsewhere, whether on shock responsive social protection, on climate change, the BRAC model, teaching at the right level, it has been evaluated a number of times in similar contexts. So there's a lot of learning already without investing in conducting RCTs. So this is basically how it all started. And then throughout the years, and even though today we're not presenting findings from randomized control trial evaluations from Egypt, but there has been a lot of achievements over the years that we have also learned from. So for example, if I would just take you over a few, I think that one of the key achievements is sparking interest of the government. So now the government would actually be speaking the language, saying that we want our programs to be more evidence-based. We want to evaluate national programs. Before we go for scale up, let us see how effective the program is. Let us see how can we make it more cost efficient. So this sparking of interest also, and as Nadine mentioned, it contributed to the establishment of a lab that is embedded within the Ministry of Planning and Economic Development that is specifically focused on running impact evaluations, raising the culture of evaluation, but also promoting the use of the admin data that are sitting within national entities. So one is sparking interest, two, the establishment of the Egypt Impact Lab, but also on, personally for UNICEF, we are engaged on 2 RCTs now with JPAL. One is on the girls' empowerment, and the second is on the early childhood development with a focus on nurseries. And we're also exploring the potential of also assessing the impact of cash versus cash plus services, because we know from global evidence that cash works. But also we know that when you complement cash with complementary services, it results in greater impact. So also we're seeing with the government and with JPAL colleagues whether we can evaluate something on this. Now, on the learnings, I think that there is still a need to develop the capacities, whether we're talking about local researchers and professors from the country, because we have excellent capacities, but unfortunately, many of the affiliated professors are outside of the region. So I think also what we are working on with JPAL at the moment is to strengthen national capacities for researchers to be able to do their own evaluations. In addition, of course, the capacity development within the government itself for them to understand what is randomized control trial evaluations, and to understand also that this is just one methodology of measuring the impact of programs, but we also need to understand that it's not going to answer all of the questions, and sometimes even it is not the right methodology to use for some programs. So just for us to understand what are the different methodologies being in place is, and also that the RCTs are not going to yield you results in a blink of an eye. We know that sometimes also it's a big investment that organizations commit to. However, there's a lot of benefits to it, because many sometimes of the criticism would say it takes years for us to be seeing the impact, or it is costly to run an RCT. But also on the other hand, if you are scaling up a program to cover millions, I think this is a more costly investment to make without having a rigorous analysis of a pilot program or an initiative before going for scale up. I think also something that we've learned, and I think this is also the value of, or the strength of the partnership with JPAL, is that it's bringing the right people together on the same table. So it is not just research and development practitioners talking to each other. No, the government and the policymakers are a key partner. From the very beginning, when we are even discussing the thematic areas that we would be focusing on, it has to be aligned with the national priorities. We need to understand what the government needs in order for the government to have buy-in, in order for the government to be able to use this evidence that is being generated to inform their programming. And definitely, like, scale up for us is very important. Just making sure that any scale up for an intervention or for a program, it is evidence-based, and we are making the best out of the investments that are going into the programs that eventually would have an impact on child and adolescent well-being. So I think overall we need to understand, we need to explore, and we need to decide on what is the best methodology for us to use to be making the right decision. Let me maybe stop here, but I'm also happy that our partnership with the JPAL in Egypt, it is touching upon the 3 areas that Ying has mentioned. So on the research, on informing policies, and the training and capacity development.
Great, thanks for that perspective, Lena. That's really interesting to hear about how you're changing the way that you're thinking about evidence and the culture around the use within government and also within UNICEF too. That's really exciting, and that you have some projects too that you're working on RCTs. We'd love to, when you have the results, please share them with us. We'll share them with the behavioral science community. And yeah, really great to hear from your side. So with that, oh, the other thing I wanted to mention is that your comment about a tool in the toolkit. I feel like we'll come up with that in the Q&A. That behavioral science and randomized evaluations is one tool you could use in your toolkit of looking at policy and programming. Okay, so now over to our final speaker for today, Kash Ramlee from UNICEF, Ukasha. Great, thank you. So yeah, over to you. If you want to share some slides, please do.
Yeah, hi. I'm going to go super quick because we're short on time. I'd love to hear from other people, from the audience. Also, some of my points have already been, I'm going to be mostly reiterating some of the points that have already been made, that have been covered excellently by my colleagues. So yeah, just to bring it back to the programming perspective, is my slides visible? Yeah.
Yes, you're good.
Okay, cool. Yeah, so talk about RCTs, experimentations, and like focusing on the value of it. So if you care about measurement, then you care about experimentation and causal inference and RCTs. So why are experiments valuable to programming in general? So it gives us precise estimates of the impact of an intervention, which is quite useful for doing cost-benefit analysis. So if we know that a certain intervention increases vaccination by 12%, then we can easily calculate what the cost of that intervention is and what the benefit is for each child that receives a full schedule of vaccinations. So this helps for planning, this helps for operations, this helps for scaling up. Better evidence for donors. We're seeing a shifting in trends where donors are starting to favor experimental evidence over traditional anecdotal reports. So from a programming perspective, this is beneficial for staying in line with the current trends. Stronger evidence for influencing policy. So that's not actually true, because a lot of studies have shown that actually policy, people that work in policy tend to not weigh experimental evidence greater than other forms of evidence, but we're starting to see that change. And there are also additional studies that show that when you teach policy advisors basic statistics or econometrics, then they tend to then shift their views and start to value experimental evidence more strongly. So that really resonates well with what's being presented here today about working with the Egyptian government to train them up on this. Allows for peer review publication, which obviously isn't a critical point, but from UN point of view, specifically within UNICEF, like these are slightly favored. We're starting to gain, and there's starting to be an expectation to publish results to legitimize the work. Why is experimentation important from a behavioral science perspective? So robust testings of mechanisms driving behavior change. So Ying presented a great example before where there were like multiple hypotheses as to what might be driving certain behaviors or what might help change those behaviors. But then beyond that, we can also look at individual mechanisms that might drive that behavior change, and running an experiment means that you can confidently identify those things. I would caveat this though, however, working within the UN, some of our programs, the value that's derived from it comes from understanding the mechanisms of certain behaviors, but sometimes we simply just need to test the program, and so we aren't able to necessarily test those different mechanisms. For example, in contexts where sample sizes are quite limited, we can't then split and create multiple treatment groups, and so the focus is more about like what is the ultimate impact of this program, irrespective of the individual components. Replications across different contexts also allows us to identify interventions that are consistent, or understanding the variance between in the interventions in different contexts, and understanding how local context actually affects the how those treatment effects might change. Contribution to a broader body of evidence to inform future interventions. If we're all experimenting and we're all sharing the evidence together, then there's an foundation that we're all building so that we're not having to repeat the same forms of research every single time, reducing costs that we can then reallocate to just directly benefiting the communities. So criticisms of experimentation, which Lena had kind of highlighted, so I'm just going to go through them here, which is typically what we hear is that it is expensive, it takes too long, or it's unethical. So I have some counterpoints for those here, which again, Lena presented perfectly, which is that it's more expensive or unethical to scale programs that have not been proven to be effective. If you're wasting money scaling up a program that you have no strong evidence to suggest that it works, for me, from my perspective, that is unethical, and that might be a controversial view. Similarly, it is more expensive to scale up a program and then years later realize that it's not worked and you've just wasted all of that money. And so it is more expensive to do the wrong thing than to simply take the time to run an experiment to properly evaluate whether something works. And there are also alternative methods to experimentations within the realm of causal inference that can reduce the time of costs. So things where you don't have to run the RCT for the entire time, and you can set times where you can look at the results and identify whether it's working, and if it's not working or it's causing harm, you can end it early. Or you can also leverage administrative data to do other forms of causal inference, for example, synthetic controls. The emphasis here is that it's worthwhile to be investing in behavioral data systems where we're continuously tracking data, or supporting governments to track a bunch of these data. So a quick example that we have at the moment is in a project in Kenya where we're able to use data that's already collected by Ministry of Health to evaluate a bunch of our programs on vaccinations, rather than needing to spend additional money and to go into the field to do data collection, which is often the bulk of budgets. Yeah. And the last point is when to not experiment, because as much as we love experimentation, it's not always the best solution. So sometimes if there's no generalizable knowledge, or we already kind of know the answer quite robustly, for example, I mean, no one's ever done an RCT on the effects of smoking, but we have we have a ton of evidence to show the effects of smoking on lung cancer. Or it's just such a very specific context in which that we're working, where the intervention is never really going to be generalizable, and so it might not be that useful. It's not feasible because the outcome variable it's too abstract anyways, and so therefore it's too difficult. Program setting is sometimes too chaotic, so insecurities, conflict areas, like let's not put anyone at risk just to run an experiment. Resources too limited. You know, running an underfunded experiment is as bad as not running an experiment. So sometimes we have to make these trade-offs, and when measurement is maybe not a priority, especially in emergency settings, for example. Cool. Yeah, thank you. Back to you, Mary.
Great. Thanks a lot for that, Cash, to run us through a number of considerations and thoughts that you're having in UNICEF, reflecting upon these things. So I can also share as always some links to the UNICEF's work in behavioral science, others like social behavior change, others to see what Cash is speaking about when he's reflecting upon a lot of these principles that he just mentioned. All right. Okay. So we have a few minutes for questions. So if all the panelists would like to turn their cameras on, we can ask the questions to all of you as they come. So I'm going to group a few together. Maybe we'll do a round. Whoever would like to respond can respond. So there's a question about, a lot of them came in during your presentation, Ying, as you were describing what randomized controlled trials are, randomized evaluations are, and kind of some clarity around that. So do you consult end users or stakeholders and you come up with your solutions? How do you generate these? So maybe that's to everybody. There's another question around what methods are used to understand the motivators to define the incentives to incorporate. So again, it's a similar thing. How do you actually do this? How do you get to the behavioral considerations? And there is also another question around where was it? Okay, we'll start with those two, and then we can. Oh, yeah, we'll start with those two, and then we can take a few others as well. So, how do you basically do this? What's more intricate in practice? How do you get the behavioral side of it? So, yeah, over to you, Ying, and maybe others who want to comment in that space too.
Sure. I think this brings up a really important point about the process and also sort of inclusivity and equity of evaluation as well. And so I value that a lot. I would point out a couple of things. One is that research process often starts much earlier than research itself. And often we find stakeholders and policy implementers, often they are sort of local government officials, state government officials, people who are fairly close to the ground and often have mandate to serve the people. They are working with a certain theory of change already and have a lot of practical questions at hand. And often we'll start with discussions and field visits and sort of qualitative interviews. And so it is the whole process of us coming to over 2,000 evaluations is essentially 2,000 innovative implementation partners, government officials who really took the experimental approach and learning agenda to their own hands. So that is something that I would emphasize. And perhaps secondly, the researcher community, as well as this approach, is increasingly locally driven. So we do have these collaborations happening very much on the ground as well. Egypt was a case of at the national government level, but often also much more fine-grained. And lastly, maybe on the methodological point, this is also related. Within the sort of quantitative evaluation, often qualitative methods are embedded at every phase of research. So from generating hypotheses to designing the appropriate survey instruments and testing them. Importantly, you don't assume that enumerators have the right, there's a lot of skills in gaining insights from people on the ground as well. And then lastly, we would also have extensive sort of post interviews and surveys that would inform the interpretation of the outcomes. So for example, in the stubble burning case, why did the upfront partial payment work? And then subsequent qualitative and other information indicate that it is a lack of trust in the payment for ecosystem service contract, that farmers don't trust that the government would pay them back after undertaking the alternative approach. So therefore, the upfront payment reduce that trust issue, and that is a kind of the interpretation that researchers and policymakers settled on after that.
Great, thanks for that, Ying. Yes, please come in, Nadine.
Yeah, maybe just building off of what Ying just mentioned to also speak a little bit to the MENA experience. So for us, it's a really, really iterative process, just as Ying was just explaining. So it takes a lot of discussions with policymakers, especially to really understand the main priorities that they would like to help address. We usually start off with what we already know. So if there's a specific challenge that a policymaker has when it comes to, let's say, improving girls' agency and empowerment, for instance, we would start off with sharing some of the knowledge that has already been generated from randomized evaluations conducted globally. And then we look for where the gaps continue to exist, especially when it comes to contextualizing this knowledge and grounding it into the Egyptian landscape. So building off of this knowledge sharing, we then hone in on more specific details where generating new evidence that is locally grounded could be helpful in informing the design and delivery of programs in Egypt and the MENA region. And then we start working together on shaping up these research questions and shaping up the outcomes of interest that policymakers would like to see improvements in. And that is when we usually bring our JPAL affiliated professors on board. We always try to strike a balance between policy relevance and also academic interest. But we find that working with policymakers from the very onset of this process really helps us then facilitate the pathway to policy change, because that then helps us improve chances of the take-up of the evidence that we would actually generate together to then lead to policy changes or pave the way for scale up if we find that scale up of a particular program would be beneficial.
Great, thanks for that, Nadine. Any comments on Cash or Lena? Or other questions? Did you want to commit? Yes, Cash, please.
Sorry, I was frantically responding to everyone, other people on the comments. But was it? Do you want me to add on to that? Or?
If you would like to, you're welcome to. How do you involve end users? If you wanted to, you don't need to.
So if we're talking about in terms of designing the behavioral interventions itself, I mean, so UNICEF has a strong emphasis on human-centered design, where before even defining the problem, we have a lot of community engagement, and then we also engage in a lot of co-creation. So any solutions that we develop alongside the community, either local governments or the community themselves. And then even when we develop the prototype, we always take it back to the community to ensure that it reflects their needs and their understanding. And yeah, so critical, not just from like a ethical consideration, but also from a effective consideration. Like if you design without engaging community, then it's never going to be great.
Great, thanks for that, Lena. Any other comments? We'll get to some other. Yes, please.
Yes, maybe on the comment for the time constraint, I think it's a very pragmatic issue that we all face. We all have donor conditionality, expiration of grants. So I think it's important to embed, if you are interested in RCTs, embed the RCTs from the very first design of the program itself. So have it included even in the proposal for the donors that you are submitting, because it's not just about the time constraint, but also it's about the funding that would go into an RCT. And it's important to have the donors involved. Like I think I've mentioned a lot on development partners, on the government, on research, but also donors are quite important as a partner, because at the end of the day, sometimes that we are very much interested in evaluating a specific intervention, but then the donor conditionalities does not allow. So also sensitizing the donors having it embedded from the very beginning. And if this is not possible, then I agree also with Cash that this might not be the best methodology for you to use. And I think also going back to, I think everyone's comment about there are many methodologies and also depends on the program, the intervention, the different limitations that you have, you pick the one that is more suitable for you.
Great. Thanks for that, Lena. Okay, so we'll cover, I'll put a few questions together. We'll answer the last 2 minutes here, but one thing, there are a few questions about sharing resources, both how you work with governments and how JPAL, and you mentioned a number of the work you do, Ying, if you want to include any more resources in the chat, colleagues would like those. There are also a number of questions that center around someone getting started or new to behavioral science. You know, you're speaking about the advanced work you're doing in Egypt with all these workshops and the RCTs, but what would be a first step? What would you say to colleagues on this call who are exploring this as potentially embedding it into their work? What are some things you might want to share with them? There's a question around involving young people in private sector. Maybe that goes back to your comment about partners. There's also a question around solid waste management, anything in that space. So there's a bit more specific questions, but let's just think about, I think there are a lot of them around getting started. What were some of the first steps you would say around for someone getting started with behavioral science? What would you suggest?
So I just pasted in another resource into the chat, which is JPAL's DDP MicroMasters program. But I would just encourage exploring our website. Our website is something of a library of evaluations. So you can search by sector, search by region, etc., and just read a bit more. Also, the Poor Economics book is always gold, I think.
Any other thoughts or suggestions? You're welcome to join the behavioral science group as well. There's a community of people across the UN getting started too. All right, okay, so no other comments on that one. Then there are some questions around what are some surprising results maybe you found from an RCT that you didn't expect from your hypothesis getting started? Are there any interesting interventions that you thought would be beneficial from the beginning, but the RCT results prove it didn't work in reality? So maybe it's kind of the flip of what you're kind of saying there. Any further examples in that space? Yeah, maybe around that sort of the testing where it's worked both ways, where you found things that helpful and maybe things that weren't as helpful. So you make that more concrete for colleagues.
I think, sorry, I don't have, I mean, I have some specific examples, but I think in a general sense, there's a tendency when you run experiments to believe that there is a right and then a wrong, or like a good result and a bad result. And I think every time you find something that challenges your hypothesis, it's always like, it's always a great thing. It's an opportunity for learning, and then you're able to pivot. But at least you've figured that out early enough before you've then like scaled it or sold it across a broad range. But yeah, there's definitely lots of times where you find something really interesting. But I guess the critical point there is to ensure that it's actually, the effect is not actually there, and it's not just like a measurement error or something wrong with the way that you've conducted your evaluation.
Any other examples of work that really illustrate that point?
I could add a little bit, touching on some of the other questions from the Q&A, which is around private sector and sort of like non-traditional areas of where RCTs have been applied, and it's informative. I think a growing area, actually there's a really growing area of evaluations on what helps in creating jobs and sort of helping micro and medium-sized firms grow in low and middle income contexts. And so it's an enormously growing area of research that is in conversation with quasi-experimental approach and many different methods as well. And there, I think what's really fascinating is the evolution of microfinance evaluations, the microcredit space that's being enormous hype and belief about transformative impact, which panned out. The large body of literature said it didn't really pan out on average, particularly for women micro entrepreneurs. But now we have a new set of really innovative, interesting evaluation that point to, okay, maybe there's no one size fits all, but certain products and certain new approaches are effective on a subsegment of entrepreneurs. And for them, it could be transformative growth as well. And, you know, we are thinking about what are the ways that work, particularly for women, for high growth youth entrepreneurs, for whatever. And that kind of like diversity of and growing evidence in the private sector relevant area is really interesting, because that really needs to be a driver of sort of like achieving sustainable goals as well.
And if I could just compliment on that specific point, especially around microfinance. So this goes back to the earlier point where there's value in running experiments across different contexts, because then we are able to identify these things, right? So like the example given was like when Rachel Meager did the meta-analysis using Bayesian hierarchical models to identify the true effect of microfinance. And the benefit there is like, okay, in the beginning we find like, okay, well, it's not really that great, but we're able to then identify the heterogeneity in the effect and able to then isolate it to those things. And so that's why, like, I would definitely encourage people to still experiment, even if you believe that something works, but you're in a different context, it's still valuable to the greater body of behavioral science, beyond just like within the context, which is obviously a hard sell for country officers when they're like, no, we don't care about what happens in another country. We are working on our program and things, but that's why we really need to push and encourage this.
Great, thanks for those insightful comments. I'm sure there's lots more we could go into, a few more nuances in the Q&A as well. But I think given that we're already a few minutes over time, I think we might just call it here for now. Thank you so much for your insights and thoughts about how we can take behavioral science and really focus on the evidence part of our thinking. So as I said, there's some links in the chat. We'll also send an email out with sort of the recording of the webinar, as well as further links if you want to know more. Feel free to email us. We can also connect you to other resources if you'd like to know more. So with that, thank you very much to all of our panelists for joining us today. A very interesting, insightful discussion. Hopefully we can continue this over our coming webinars over the coming months and years. Thanks. Thanks, everyone.